Hello and welcome. My name is Dr. Calliope, and I am going to be conducting a cardiovascular and peripheral vascular examination on you. How are you doing today? Okay. I hope by the time you leave this examination, you feel even just the littlest bit better. Alright? Okay, so let me grab my clipboard. It is very, very windy out today, isn't it? I heard that we had gotten quite a bit of hail this morning. Woke up to the sounds of thunder, which was quite nice. It's been many months since we've had a thunderstorm here. Would you mind just confirming your name and date of birth for me? Okay. Excellent. And is that your preferred name? And how do you like to be addressed? Very good. Okay. So, looks like there aren't any new changes to your medical history. Is that correct? There's nothing we need to add at all? Okay. And no changes to your family history, your allergies, or medication list at all? Okay. Alright. If you think of anything, just let me know, okay? So, we're going to start with the upper extremities. Now, for this examination, I'm not going to be using any gloves, as much of the examination relies on me being able to feel with the greatest accuracy, doing some palpation, doing some different tests to make sure that you're in tip-top shape, and gloves can get in the way of that. Is that okay with you? Okay. And next, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Excellent. Thank you. As I said before, we're going to start with the upper extremities. So your upper extremities, of course, would be pertaining to your arms. I'd like to do just a little general inspection of the arms, the skin of the arms, okay? I'm going to start here, if you don't mind. Please let me know if at any point you feel any pain or discomfort, okay? So I'm going to start right here at the shoulder and just go down. Okay. Looking for any signs of obviously a cardiovascular / peripheral vascular problem. And generally that pertains to your circulation when we are dealing with the arms and the legs. The color looks good. Not seeing any swelling. I'm going to feel around your arms as well. Make sure there aren't any sites that are swollen. Okay. Very good. I'm just going to switch to the other side here. Just taking a general look at the arm. looks to be in great shape, and the hair distribution on both of your arms is quite normal. Now I'm just going to be feeling your arms with the backs of my hands. I'm going to be feeling the temperature. If there is a drastic temperature change from different parts of your arms, or if one part is very hot or very cold, okay? I'm just going to be feeling very lightly the backs of my hands. Okay, and would you mind just showing me both of your hands? Just keep them right in front of you with the backs of your hands facing the ceiling. Okay. A lot of different cardiovascular issues can present themselves in the nails and the hands. Okay, I'm just going to press on your nails and I'm going to check the capillary refill. Okay, just going to press, release, 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 press, release. Lastly, press and release. So every single one of your fingers had a near instant rebound, so that's good. Means you have good circulation. Okay, so now I'm going to be palpating the radial and brachial pulses in both of your arms. Okay, so I'm going to start with the radial, and that is on your wrist, on the thumb side, right here. Okay, I'm just going to be feeling that pulse. And I'm just going to be feeling the cadence, the strength, and the quality. Okay, I'm going to feel the brachial pulse, which is in the crook of your elbow here. There we go. Good. Okay, the other side, radial pulse. Okay, and the brachial pulse. Just keep your arm relaxed. Just relax. Good. Okay. So now I just want to feel both of your radial pulses at the same time. I'm looking for what's known as a radial delay, and that just means that there's a delay in one pulse or the other. Okay, they're not beating simultaneously. I'm just going to be feeling both your wrists and feeling both of the pulses. Just for a few beats. Okay, very good. So they are well within sync, which is good. Now, this might be a bit of an odd question, but I just wanted to ask, have you had any sort of infection in your arms as of late? Okay. The reason I ask is I'm going to be feeling some of your lymph nodes in your arms. Now, they are right on the back of the arm here, just above the elbow, and they really shouldn't be able to be felt with most people unless you've had a recent infection in that area, okay? But just to make sure, I want to check. So I'm going to start with this arm, and I'm just going to just gently palpate, feel if I can, see if I can feel any lymph nodes there. The other side. Just relax your arm. Let it relax. Okay, good. I couldn't feel any of your lymph nodes there, so that's good. So now we're going to do a test known as the Allen test. The Allen test entails me pushing down on your radial and ulnar arteries. When I do that, it's going to stop the blood flow to your hand, and your hand should get paler. And I'm going to release the pressure on one part, and we're going to see how quickly the blood returns to your hand, and then we'll do it on the other side as well, okay? So let's start here. Okay, now you hold your hand out, and I want you to make a fist, okay? I'm just going to press down on those two arteries there for a few moments. Okay. All right, I'm going to have you open your hand, and I'm going to release the pressure on the ulnar artery. Okay, and that pinked up pretty quick. So I'm going to have you close your fist again, and I'm going to press down on the ulnar and radial arteries once more. And then if you open your hand, and I'll release the radial artery, and the blood flow returns pretty quickly again. Good. We're just going to do that on the other side as well. So I'm going to have you make a fist with your hand. I'm going to press down on the ulnar and radial arteries. If you could open your hand, I'm going to release the ulnar. And there we go. Okay. If you want to go ahead and close your hand again, make a fist. And I'm going to press down on the ulnar and radial arteries. And then I want you to open your hand while I release the radial artery. Good, good, good. Okay, and the color returns quite quickly. That's good. Okay, if you need to, you can shake out your hands for a second. We're going to be moving on to the chest in just a moment. Okay. So now we're going to be inspecting the chest wall. Now, I didn't see any past history of any surgeries involving the chest wall. Is that correct? You haven't had any sort of surgery or device implanted at all, like a pacemaker? Okay, good. So I'm just going to inspect the wall here, and we're looking for any places where it sunken in, any sort of deformities, okay? Very good. Good. Okay. Now if you could just lift up one arm for me. Just doing a little bit of a light palpation here. Just a little bit. Okay. Right, and you can put that arm down. You can lift the other one. Very good. Good. Just a little bit of palpation here. Just to feel for any deformities. Okay, you can put your arm down. All right, now I'm going to grab the stethoscope and I'm going to be auscultating around your chest. That's just a fancy word for listening in. Now, I want you to just take normal breaths for me, okay? Right, and I just want to listen here to the atrial area. Okay, the pulmonic, the tricuspid here, and the mitral. I'm going to backtrack a little bit and I am going to listen to the apex beat. Okay, very good. So upon that bit of auscultation, just with the diaphragm without any accentuation maneuvers, I haven't heard any sort of heart murmurs. Now, real quick, I want to do a little bit of an accentuation maneuver with you. Just while we're here, I'm going to have you lean forward for me, okay? And while you do that, I'm going to listen around for any murmurs that are exacerbated by that movement. Good. Okay, you can go ahead and lean back. Now, we could do quite a few different maneuvers if I was concerned about a possible heart murmur. We could have you stand up, we could have you squat down, have you bear down, but I think that you'll be all right. I haven't heard anything out of the ordinary with our regular auscultation. Okay. Lastly, for the moment, I want to take a listen to the area around your kidneys for any bruises. Okay, so I'm just going to listen on your back around here. Just going to listen for any bruises, any heart murmurs. Good. Right, and the other side. Just checking for any bruises. just going to note that we didn't hear any bruits in the kidney area. Now, I am a little limited by this particular stethoscope as I only have the diaphragm and not the bell. And for certain parts of the exam, I would need the bell. For example, when listening to your kidneys. However, listening with the diaphragm, there wasn't anything out of the ordinary. If there was, then I would do a re-auscultation with a stethoscope that has the bell, okay? The bell's better for listening to lower pitched noises, while the diaphragm is better for higher pitched noises, okay? So let's pop this back in and let's do a little auscultation on your carotid arteries. I'm going to be listening again for any bruits in the arteries here. So I'm just going to put this to the side of your neck. I'm going to have you take a deep breath in and hold. Breathe out. Good. Take a deep breath in. And hold. Okay. Very good. All right. You can exhale. Now, I'm going to be palpating the carotid artery, okay? This might be a little uncomfortable, all right? Other side. Okay, very good. There we go. So now I'm going to have you recline a bit, and we are going to take a look at your JVP, or your jugular venous pressure, okay? If you would just recline a little. There we go. Okay, comfortable there? All right. Now I am going to have you turn your head to the left for me, okay, so that the right is exposed. And I'm just going to get a pen light here, and this will help me see the pulsation in your neck here. I'll be looking in this area for the pulsing, and this little light helps add a bit of contrast, okay? I'm just going to be shining this at an angle that I can see the pulsation a little bit better. Okay, I can see it right there. We're going to do a quick test, so hold that position. I have a ruler here, and I'm going to be measuring that pressure. So I am going to put this ruler at the sternal notch here, and I'm going to take this wooden stick here, and I'm just going to be placing that from the top of the pulsation to the ruler. Okay, so that is just over 2 centimeters, right? Anything over over 3 to 4 would be an elevated JVP, but you do not have that. Okay, and I'm just going to be pressing down on your liver area, and it's going to be a little uncomfortable, but it'll only be for a very short time. And I'm going to look at your hepatojugular reflux, okay? So if I press down your liver, okay, right here, that pressure is increased, and if I release it, it should go down. Good. Okay, that's good. I'm going to recline you even further, and we're going to be doing some more palpation and auscultation around your chest wall, okay? So we're going to get you lying all the way flat there, okay? And I am going to palpate around the areas that we already listened to the stethoscope. So we start with the atrial. I'm just feeling with the tips of my fingers here. We move on to the pulmonary area, pulmonic. And then we go down along the sternal border, and we feel the apex beat. Apex beat is generally at the mid-clavicular line, 5th intercostal space. Okay, very good. And if you wouldn't mind turning, so let's see, you'd be turning to your right. Okay, so then I'm going to be feeling those same places with the ball of my hand, right? We start back up at the atrial area and move down to the pulmonic, along the sternal border here, and to the apex beat. Very good. Good. So we're going to be focusing on your apex beat a bit. So let me go ahead and locate that with my fingers. Right? And now I'm just going to be feeling for a few moments, and then I'm going to have you turn, okay? All right, very good. So I'm just going to have you turn on your side, turn this way, good. And I'm going to keep one finger on that apex beat here. Good. And then we can go ahead and just turn back. All right? Now, normally I would be, again, auscultating all the areas with the bell of the stethoscope as opposed to our diaphragm, but I'm just going to take another little listen, okay? We have the atrial, just breathe normally, the pulmonary area, neutral. And we have the apex bead here. Okay, very good. Very good. All right. Now we're going to be moving into examining your lower extremities, namely your legs and your feet. First, I'm going to start with auscultating your femoral artery. I'm just going to, real quick, feel for the pulse point. And then when I find it, I'm just going to put the diaphragm of my stethoscope on it and take a little listen. You can breathe normally, don't have to do nothing special. Okay. Good. And the other side, I'm just going to feel for the pulse point and then press the diaphragm to the point. Good, okay. Now I just want to palpate that area. Okay, the other side. Very good, okay. So now I'm going to be looking for edema or swelling in your legs. We're going to start by your ankles. So when I'm looking for edema here, I'm going to be pressing my thumbs into certain areas and see if there's any pitting, any indentation where I press. Okay, I'm just going to feel a little bit up the leg just to make sure. Okay, and the other side, feeling for any pitting, edema. Okay, the leg a bit. All right, very good. Just take a couple of notes here. Okay. So now we are going to do something a little odd. I am going to raise up your legs and we're going to check the circulation in your legs and feet, okay? So I'm going to raise your legs, okay? And we're going to keep them up here for a little bit until they start getting quite a bit paler, so we know that the blood has drained out of them. Okay, and when I drop your legs, I'm going to have you come up to a sitting position, okay? Alright, so we're going down, and if you could come up and sit up, I can help you here. Okay, and I just want to look at your feet, and there's the color. Very good. So That means that there is some good circulation there. Lastly, I just want to measure around your ankles. I'm going to be using a little metal tape measure here. And we're just going to be checking that your ankles are symmetrical for the most part. There can be a touch of deviation, but we want to see if there is any quite large discrepancy. Okay, so I'm going to take one ankle here and I'm going to wrap the tape around. Okay, and that is 22 centimeters. And then we're going to do the same with the other ankle. Okay, just wrapping that around. Very good. And 22 and a half. I'm just kidding. It's 22 centimeters. Okay. Very good. That's all I needed with that. Okay, so that concludes our cardiovascular and peripheral vascular examination. Do you have any sort of comments or concerns, any questions at all? Okay, all good? All right. I didn't find anything out of the ordinary. You're a very healthy individual with an excellent circulatory system, okay? All right, so I'm going to go ahead and sign off. Very good. And that will end the exam. Thank you so much for coming to me to have your cardiovascular, peripheral vascular examination. Really hope you enjoyed it. I hope you have a whale of a day and a good rest of your night. Thank you.